Hi and welcome to Don't Get Offended with me, Sarah Donohue. This is an informative shooting from the hip podcast series looking at everything first world regarding life, health, both mental and physical, and a look into everyday topics, covering a whole host of important issues, casting a more realistic yet blunt view on our everyday life, our trials and tribulations, touching on topics which everyone has a difference of opinion on. Now, in the light of the recent death of British anti-vaxxer 42-year-old John Eyres, we take a look at a seemingly healthy individual being affected so badly by COVID-19. But more so, we look at anabolic steroids, and is there a correlation between steroid abuse and the onset and effects of COVID-19? And if John Eyres did take steroids, would he have been better being vaccinated because he is an anti-vaxxer? Now, it's widely known that many steroid labs are simply in a garage or someone's kitchen, and who knows exactly how they are made. So how do you know exactly what you're putting into your body? Now, that's no different to anti-vaxxers who take recreational drugs like cocaine, which is often cut with rat poison, or indeed if they take steroids. But they won't take something developed by a scientist, leaving many people dumbfounded. And there are indeed a lot of bodybuilders, fitness models and bikini girls in the fitness industry that are totally anti-vaxxers, preaching that they won't put an unknown substance in their body, but all the time brimming with steroids, fillers and implants. And I see this daily on social media. Now, I'm not stating that John Eyres was a steroid user, but if he was, even those closest to him wouldn't know. And as they state, he was fit and healthy, and they don't understand how he died. Well, let's give us some food for thought here, as he isn't the only fit and healthy bodybuilder who has died at a young age of COVID-19. Now, it's a well-known fact that many bodybuilders would sooner admit to taking cocaine rather than to using steroids. But it doesn't take great detective work to know who is using and who is natural. This is both male and female, and the numbers of male users in their teenage years is rising, and one of the biggest rises of usage in previous years has been women using steroids. And as we get older, our ability to build and retain muscle depletes. It's just a sign of aging. That is the way it is. And turning to steroids is sometimes an option. Do I think that this particular bodybuilder died because of underlying drug abuse of which he withheld from doctors, so they couldn't make an informed decision to give him something to counteract the detrimental effects of steroids once he contracted COVID? Quite possibly. First, I'm not a doctor, nor am I a medical expert on steroids, or a medical or respiratory expert. This is information gathered through advanced research over the COVID period by experts. Now, people with substance use disorders may be particularly vulnerable to COVID-19 and its adverse health outcomes. I mean, in the early days, the experts had nothing to support this, very little data. However, now they have greater confidence on speaking on this subject. So let's dive in. We'll take a look at all drugs, but first let's take a peek at anabolic steroids. I don't think it's any secret that anabolic steroids and other performance-enhancing drugs have been previously reported to trigger respiratory problems and distress and severe viral pneumonia in young patients. One steroid looked at in depth during COVID was oxandrolone. It's a man-made steroid which helps to build muscle. It's often known as oxandrin or also Anavar, and Anavar is commonly used amongst the female bodybuilders and bikini girls. Now, oxandrolone is regarded as a dihydrotestosterone, in short, a DHT. And a DHT is a hormone that stimulates the development of male characteristics. Now, I'm not saying that bikini girls want to look like men. Of course I'm not. but it's a sure way of keeping body fat at bay and building muscle quickly to give a great bikini shape when taken in short bursts. Now again, I quote that DHT promotes the expression of transmembrane protease 2, better known in short as TMPRSS2. And this TMPRSS2 plays a crucial role in COVID-19 infectivity, since COVID-19 employs it for spike protein priming. So the bottom line is, and in layman's terms, taking anabolic steroids can make you more infectious. And if you take steroids and catch COVID, then unless you tell medical professionals, they can't counteract and balance this by giving you anti-androgen therapy, helping to reduce the levels. Now, anti-androgen drugs work by blocking the effects of androgens, and androgens of course help build muscle mass and strength, hence they are commonly used by bodybuilders and strongmen and other athletes, crossfitters for example. Findings from placebo-controlled randomized clinical trials found that androgen therapy has been shown to reduce COVID-19 viral shedding. Now, viral shedding is when a person has the virus. We may not even know that they have it because they might not even have the symptoms, but we shed viral particles when we talk, when we breathe, and when we eat. No different than when a cat sheds fur. We shed all the time. We leave these particles everywhere. But admitting to the use of anabolic steroids if you have COVID is vital for treatment. I've no idea how many people who take steroids and have contracted COVID and have admitted to taking steroids, but this finding was a first when it was reported that a young, otherwise healthy patient taking anabolic steroids with severe COVID-19 symptoms was successfully treated using anti-androgen therapy. Now, from his perspective, when asked to describe his experience of this, he actually reported that, and he said, before I started the treatment for COVID-19, I was taking oxandrolone, and I noticed a great improvement with suspension of oxandrolone and the start of the treatment prescribed. So what he's saying there is he stopped taking oxandrolone and they started treatment. And from day one to the next, he felt better. And it was a great, great improvement. So what learning points do we have from this? And again, I quote, that anabolic steroids may increase risk of COVID-19, and especially the severity. Now, early administration of potent anti-androgen improved symptoms and laboratory markers of disease severity. Now, early anti-androgen therapy in patients with increased androgen activity, such as those who are taking anabolic steroids, may contribute to reduction of symptoms and the severity of COVID-19. So, if you are taking steroids, you are putting yourself at a greater risk of not only contracting COVID, but also of it being a worse case than if you didn't take them in the first place. And that is because taking steroids makes you more infectious. There is a disproportionate amount of bodybuilders who are anti-vaxxers. And I imagine it's because they don't want the cocktail of steroids and this relatively unknown substance in their body, which makes no sense. However, being open and honest with the doctor treating you allows him to medicate accordingly. So we go back to John Eyres, who was seemingly very fit and very healthy and a great bodybuilder, but died of COVID, when we know for a fact that people young, fit and strong and healthy shouldn't die of COVID if they don't have underlying health conditions, which hasn't been reported that he did. So did he take steroids? And was it his guilty secret that eventually killed him in the prime of his life? So here, let's look at all the substance abuse and not focus particularly on anabolic steroids, because steroid users for some reason don't see steroids as a drug or a problem. They kind of see steroids like a supplement, a bit like a protein shake. But if we look at other substances in relation to COVID, then many users won't really come forward for treatment because of the stigma surrounding those that take drugs. Now, these social barriers delay many people in coming forward, putting them at greater risk. And it's no different than a bodybuilder may well not disclose to the doctor what he or she is taking, probably because they are deluded and still think they're natural, and because of the embarrassment attached. This year, experts from Case Western Reserve University and the Metro Health System in Cleveland published an analysis of electronic health record data from more than, and I quote, 73 million patients at 360 US hospitals, of whom 7.5 million, that's 10.3%, had substance use dependency. Now, 12,030 had COVID-19, and it was clear from their analysis that people who abuse drugs are indeed at higher risk of contracting and suffering worse consequences from COVID-19. Now, this was especially true for African Americans. And I quote, people with substance dependency were significantly overrepresented amongst those with COVID-19, making up 15.6% of the COVID-19 group versus just 10.3% of the total people. Now, the risk of COVID-19 was highest amongst those who had received a diagnosis of dependency within the last year. Those with a recent dependency on drugs were 10.2 times more likely to contract COVID than those without a dependency, followed by recent diagnosis of tobacco use dependency, which was 8.2 times more likely to contract COVID, alcohol use disorder, and you were 7.8 times more likely, cocaine use disorder, 6.5, and if you were smoking cannabis, 5.3. Now, the scientists also state that the reasons for the increased risk of COVID-19 infection and adverse outcomes amongst people with substance use disorders are complex. First, many kinds of chronic substance use harms or weakens the body. And it weakens the body in ways that make people who use substances more vulnerable to infection, such as opioids. They compromise respiration. The slowing of breathing caused by opioids can lead to hypoxemia, reduced blood oxygen, which can harm the brain as well as compromise cardiac and pulmonary health. Now, behaviours associated with opioid use and certain other kinds of illicit drugs also raise the risk of contracting infectious disease of all kinds. Despite social distancing, people with drug addictions need to interact with other drug users or dealers, for example, in order to obtain drugs. And this goes for steroids as well. They have to meet their drug dealer to get their fix. So what we have learned is that although those taking steroids want to appear natural, who are you kidding? You have big bodies and your head is still the size of a pea in comparison to the rest of you. And the bikini girls, so many of you are starting to recede slowly on the hairline and your voice is deepening. So you aren't kidding anyone about using steroids. Now protect yourself and take the vaccine. Before John Eyres died, he said that he had wished he had taken the vaccine like his twin sister had done. And if he had, he would probably have still been alive today. And if he was a steroid user and had been open with doctors, he again would possibly be alive today. Anti-vaxxing steroid users are massively at risk. Help yourself and get vaccinated. And for the record, I'm not against or for the vaccine, but it's been developed by scientists, not in someone's garage, and it hasn't been produced in a garage. I have been double jabbed simply because I want to travel freely. I want to hop from one country to another. Thanks for listening. I hope you like my podcast, Don't Get Offended with me, Sarah Donohue, and please do download that on any of your favourite podcast platforms such as Apple Podcast. or a Podmatic. Thanks for listening.